Governor, last night was one of your last State of the State speeches, but what made it unique was you had really a laser focus on drug abuse and getting off and stopping drug addiction. It's no longer the person in the ghetto somewhere. It is everywhere. Why did you choose that topic? What hit home?
About 1 of every 12 high school students say they're using Vicodin. 1 of every 20 high school students say they're using OxyContin. And that 4 out of 5 of those kids who use those drugs become heroin addicts.
Wow.
I mean, this is, last year in New Jersey, 4 times the number of people died of a drug overdose than were murdered. 3 times as many people died of a drug overdose than died in an automobile accident. Mm-hmm. This is an epidemic, and we need to understand that this is a disease. It's not a moral failing, it's a disease.
Sure.
And we need to treat it. And by the way, we see it happening, as you said, to people at every different economic level, every different level of education. It doesn't matter, it doesn't discriminate, and it's killing our neighbors and our friends.
Absolutely, and I've actually been to some town halls in New Jersey about this, because it starts, in many cases, kids they just take the stuff out of the medicine chest. Next thing you know, they're buying the Oxy on the street, but it's really expensive, so then they get heroin because it's really
cheaper. Yep, it is. And now you're having young people, middle-aged people, working professionals who are becoming heroin addicts. And it is tearing our country apart. 50,000 people in America in 2014 died of a heroin overdose. 50,000 people.
Right.
So this issue needs to be addressed, and we're going to address it very aggressively in New Jersey because our citizens are dying.
How though? Especially a lot of them have no money, and they got to go into facilities, and they don't have the insurance to pay for those facilities.
Well, listen, first off, we know that in New Jersey, for the very poor, Medicaid has covered drug abuse treatment now, and we have 5 times as many people who are very poor on Medicaid getting drug abuse treatment now. That's good. Wealthy people get to pay for their drug abuse treatment. They have never had a problem. What I said yesterday is insurance companies now are saying no regularly to drug abuse treatment, and it's wrong. So I've asked for them to...
give you a week in rehab, which is nothing.
Nothing. So what I've said is I'm asking for a law to be passed in the next 30 days. This is if you have health insurance in New Jersey, 6 months of coverage for inpatient drug abuse treatment without denial. Now, because think about this. If you have a member of your family who has a drug abuse problem, you're going to put them in inpatient treatment because, well, why not? Mm-hmm. It's a last resort. You're going to put them in someplace because you have no place else to go. You're desperate.
But that's too expensive for these insurance companies to be able to cover.
Absolutely not. Of course they're going to be able to cover it. Insurance companies, health insurance companies in particular, post-Obamacare, are making more money than they've ever made in this country in recent history. The fact is that we're losing our citizens. They pay for health insurance. This is a disease. They don't deny them for cancer. They don't deny them for heart disease or diabetes. This is a disease. And as Steve said, you know, kids come, they try some prescription medication they find in their parents' medicine chest, and they think it's okay. Before you know it, we had a story that we were talking about yesterday of a young man who started to take some painkillers. Within weeks, he was a heroin addict.
Yeah.
Oh my God.
And parents, it happens like this to a parent. And then what do? We cannot choose to let insurance denials cost our kids their lives. We pay for this insurance. We need to get them treatment, and we got to.
And your hope this will be a model for the country. If it works in New Jersey, that's your goal over the next year to make it a model for the country.
Absolutely right. And I don't think there's anything. If any of your viewers out there, I bet you there's none of them who haven't had their own family or a neighbor or friend touched by this epidemic.
You're right.
And so it's time to get to work.
Governor, thank you very much.